What's the first thing that you're telling your clients to do?
Well, there is next week. There's a really key meeting with respect to what is considered to be who is considered to be a full-time employee, and I think the real issue is if you're over 50 and you're going to decide to offer health care, and as is, it's really business as usual. You're going to go through the normal procedures of looking at the plans, looking at the designs, what is the most efficient way to go about it. We're certainly seeing that high deductible programs, putting in more consumer-oriented components in these plan designs, are helping to strike a balance between, corporate expense and good affordable coverage to the employees. And that's been the trend over the last 24 months. It's worked very well to curb premiums, and it's a bit of a cultural change to retool people's thinking about the fact that they just cannot walk in and have a $20 copay, that they actually have to have some skin in the game in the procedures. Then you have the group that's over 50 that's saying, well, do I even want to offer coverage going forward? And if I want to offer coverage,
Over 50 years old or 50 employees?
50 employees are saying, well, do I want to offer coverage? Am I willing to take the penalty? Let me do the math. I pay X amount of dollars in premium. I'm not going to offer it. I'm going to take a penalty, and I'm going to send my people or access the exchanges. We don't know what the pricing looks like on the exchanges, so it's a little bit of a difficult comparison right now because there's no benchmark to compare it to. But in theory, that's the big question. And there's a couple of steps that you have to go through to determine whether or not that is a good economic decision.
I want to get back to that in just a second. Nancy, when we've seen you at county association events in the past, on both occasions you said it's really going to be up to the employee now to take more responsibility in their health care.
Well, I think it will be, because all employees are going to have health insurance coverage. And so whether or not they're offered it through their employer, or whether or not they are eligible through their spouse, or eligible as an adult child under parents coverage, or want to purchase through these state-based exchanges or regional-based exchanges, it's something that every employee is going to have to evaluate. Employers do have obligations. They have to provide every full-time employee, and those are employees who work more than 130 hours per month, probably calculated over a year period. They have to offer coverage that's affordable and meets a minimum value test. And it's one plan they have to offer for individual coverage that meets all the tests. So the employee is going to have to understand where they're going to get health insurance coverage and recognize that they're going to have to pay a premium towards that coverage, whether or not it's through their employer or through an exchange or another place to get coverage.